Hello, and welcome to this supplemental training from Total HIPAA Compliance on the updated rules from HHS on reproductive health information. My name is Jason Karn, and I'm the Chief Compliance Officer at Total HIPAA, and I will be walking you through these updates today. Starting December 23, 2024, covered entities, business associates, and business associate subcontractors must comply with new federal regulations that impact how reproductive health information under HIPAA is handled. These updates from the Department of Health and Human Services, or HHS, expand the definition of reproductive health care and introduce critical safeguards for its protection. HHS has provided the following list of services now considered reproductive health care: contraception, including emergency contraception, preconception screening and counseling, management of pregnancy and pregnancy-related conditions, such as hypertension, preeclampsia, ectopic pregnancy, and gestational diabetes, prenatal care, miscarriage management, pregnancy termination or abortion, fertility care, examples include IVF, diagnosis or treatment of conditions that affect the reproductive system, examples include menopause and endometriosis, mammography, pregnancy-related nutrition services, and postpartum care products. A covered entity or business associate may not use or disclose PHI related to reproductive health care for any of the following activities. 1. To conduct a criminal, civil, or administrative investigation into any person for the mere act of seeking, obtaining, providing, or facilitating reproductive health care. 2. To impose criminal, civil, or administrative liability on any person for the mere act of seeking, obtaining, providing, or facilitating reproductive health care. And 3. To identify or discriminate against any person when determining eligibility for reproductive care for any purpose. Reproductive health care is considered lawful if it meets any of the following criteria. 1. It's legal where it happened. The provided care is legal under the laws of the state where it was provided, considering the specific circumstances. For instance, if a woman travels outside her state to obtain an abortion that is legal in another state, then that individual cannot be prosecuted for the procedure in her home state. Number 2, federal law says it's okay. The care is protected, required, or authorized by federal law, including the U.S. Constitution, irrespective of the state where it was provided. For example, the use of contraception cannot be prosecuted in a particular state as it's permissible under federal law. 3. Someone else did it. The care was provided by someone other than the healthcare provider, health plan, healthcare clearinghouse, or their business associates, who receives the request for patient health information, and the presumption of lawfulness applies. For instance, a provider, health plan, etc. cannot be prosecuted for knowing about a procedure if they didn't perform it. Any parties that request PHI potentially related to reproductive care for one of 4 purposes: 1. Health oversight activities, 2. Judicial and administrative proceedings, 3. Specific law enforcement uses, and 4. Certain coroner or medical examiner uses, must sign an attestation from the requesting party before the covered entity or business associate may disclose this PHI. HHS has provided a template stating that the requester will not use the PHI to violate this rule. What hasn't changed? Healthcare providers, health plans, clearinghouses, and their business associates are still allowed to use or disclose PHI in the following situations. 1. Defending against misconduct claims. They can use PHI to protect themselves in investigations or legal proceedings related to alleged professional misconduct or negligence, even if it involves reproductive health care. 2. Defending others in legal proceedings. They can use PHI to defend anyone facing criminal, civil, or administrative charges for providing reproductive health care. And 3. Responding to audits. They can share PHI with an inspector general if it's needed for health oversight audits. To prepare for these changes, Total HIPAA has sent your organization updated policies and procedures, a revised Notice of Privacy Practices, or privacy notice for our agents, that reflects these changes, and a link to the attestation template for use with parties that request PHI potentially related to reproductive care. In conclusion, these new regulations highlight the evolving landscape of reproductive health care and the heightened emphasis on individual privacy. It is paramount that all covered entities and business associates understand and adapt to these changes to remain compliant. Organizations can navigate this complex terrain by implementing these updated policies and procedures, training staff, and enforcing these new rules while safeguarding privacy and access to essential reproductive health care services. If you have any questions about this ruling and how this affects your organization, please either reach out via email or you can submit a support request. Thank you and have a great day.